it was interesting in in 2018 election, the attempt to repeal the health care law was responsible for 70% of the advertising that the Democrats did, who won seats, won Republican seats. So, my view is that we should pick the low-hanging fruit first. I think we need to pass a public option and go back to encouraging all payer systems in states so that you can have some control over cost and keep it as simple as possible. The great appeal for the single payer system is it's universal and it's simple. And it also recognizes why Medicare and Medicaid work with much lower overhead, which is that costs are more predictable. Okay. 80% of the costs in healthcare in any given year are claimed by about 20% of the people, and it's a floating 20%. So if you insure a relatively small pool, you have to overcharge people 4 out of 5 years, because if you catch the bad year, you'll get broke. And therefore, whatever we do going forward needs to recognize this. But I think there's things that can be done now on drugs, copays, deductibles, and getting people back in pools that don't by indirection get rid of the pre-existing condition elimination that was at the core of what Obamacare was all about.